Besides our mom's examples we shared from our previous videos, would you like to hear other real-life examples of those we've helped in the last 18 years who are in the exact same position as you are today? By sharing these stories along with our 5-point checklist, our goal is to help you to be confident in which decision is best for you through just one video. We have never tried this before, so let us know at the end of this video if you now are confident and no longer confused.
And if you're still confused, then just don't comment. Hi, I'm Kai Chung.
And I'm Ann Chung. As we go into our real-life experiences, we will also cover 5 main points you must consider when choosing the right plan for you. In our past videos, we showed a lot of exaggerations and sales pitches regarding Medicare Advantage and Medicare Supplement plans.
But did you know the first step is not deciding between the two plans? The first decision is to ask yourself, do I want to forfeit my original Medicare plan or keep my original Medicare plan?
Now notice that Kai did not mention that you will throw away your Medicare card or you're no longer in the Medicare system.
Right, I'm referring to actually who is in control, who's paying or denying your claims.
And we are referring to who's in control. You are referring to whether original Medicare or the insurance company called Medicare Advantage, right?
Correct. First, let's discuss why some people would choose to keep their original Medicare plan. Notice this from the government guide called Choosing a Medigap Policy on page 7.
Here it states Medicare gives you the right to use any doctor or hospital that takes Medicare anywhere in the US. This is the #1 reason most people would never choose a Medicare Advantage plan. This is the primary reason why my mom chose original Medicare.
Now that sounds like a no-brainer, right? Well, some just don't care about that right or freedom to go to anywhere in the US like my mom. She would rather have an all-bundle plan called Part C, Medicare Advantage plan, that runs around 0 premium to less than $100 a month.
Before he goes further, remember, on both sides, you still pay $164 a month for Part B. Also, please note that the government is paying the insurance companies around $1,000 per month per person. Why? So Medicare is no longer responsible for paying for your claims. Now remember this rhyme. Part C will replace your A and B.
Nice, you're a poet and you didn't even know it. Now, people like my mom, they don't care about replacing their original Medicare plan. They're more concerned about the monthly payments rather than the freedom to go to any doctor in the US. Clients like my mom do not want to pay that extra $100 to $150 more for a Medigap plan, drug plan, dental, vision. And the client we mentioned earlier who almost got hit by a semi-truck while riding her Harley slammed into the wall barrier and was hospitalized for 2 weeks. She later called me while still in the hospital, asking about her co-pays regarding her Medicare Advantage plan. After I asked her if she would want to switch back to Medigap since she just turned 65, she asked me what her monthly payments would be. Now, after I told her, would you believe what she said? She said, no thanks, I don't want to pay that much. Yes, while still in the hospital. And she stayed with her Medicare Advantage plan.
Yeah, I remember that client. This shows you that there are many examples where people do not regret deciding on a Medicare Advantage plan just because they got sick or was in an accident.
Yes, she didn't mind the insurance company being in control and didn't mind her co-pays. And plus, all her claims were covered.
Now, what about Medicare Advantage PPO plans with no premium? Don't they have the freedom to choose any doctor? Do you still forfeit your original Medicare plan with a Medicare Advantage PPO plan?
Well, with original Medicare, there is no in or out of network. Basically, Medicare is in all 50 states. Either the doctors take the original Medicare or they don't, which we'll talk about later. But with a PPO Medicare Advantage plan, the insurance company dictates who is in or out of network. So what's the big deal?
Some clients, like my mom, don't want the hassle of thinking who's in or who's out of the network. Plus, if you go out of network, your co-pays or your co-insurance can be very high. So if you enroll in a standardized Medigap plan, then you will never have a network, never need to check to see if your doctors or hospitals are on the plan. The bottom line is there is no network with a standardized Medigap plan.
That's true. So be careful. Don't let any salespeople talk you into a PPO, making you think it's like a Medigap. Now, why do we say it's like? Because it comes down to who's in control. Remember what I said earlier, point number 1. You either have Medicare in the driver's seat or you forfeit your original Medicare plan and the insurance company has total control.
If you have a Medigap, this is another reason why some choose to never buy a Medicare Advantage plan. There have been many cases where Medicare Advantage plans have denied care. Now here's a key point. If being in control of your healthcare is the most important and you do not want the insurance company dictating your care, then you want to have original Medicare as your primary and choose a Medigap or supplemental plan. Yes, no matter how you argue the cost of which side is better, one thing can never be argued is original Medicare tends to authorize more care than Medicare Advantage plans. And it does not matter whether you have an HMO or PPO Advantage. The insurance company can still authorize or deny the care.
Yes, you are no longer covered under original Medicare in those situations. We recently had a viewer call and ask us to help switch his 83-year-old parents to a Medicare Supplement plan because his dad was denied care for home therapy. Now, the home therapy company said that if they had original Medicare, they would have been covered.
Now, to be fair, his parents have had many services throughout the 18 years and were never denied care under the Medicare Advantage plan. It was not until recently when his dad needed home therapy that they were having trouble. Yes, friends, do you care if the insurance company is in control?
Or are the monthly payments the most important to you? We would love to hear your opinion in the comments below. Now, after deciding if you want original Medicare or Medicare Advantage plans, the next point you must consider is coverage or benefits.
Point number 2 to buying a Medigap like a plan F, G, or N is you want to have no or very little copays. Regarding cost and coverage, this can be argued on both sides. We mentioned this in detail in our other cost comparison video. For example, original Medicare with a supplement plan F or G can be more cost effective when you get sick.
However, the argument against a supplemental plan is the thousands of dollars you save by not paying for a Medigap and choosing a Medicare Advantage plan. My mom has saved over $30,000 over the last 17 years since she's been on Medicare. For more details on the entire cost comparison, you can click on the full video right here.
Now, we're not saying coverage is not important. However, each person's value on coverage can differ. Some feel that having 100% coverage with a Medigap plan F or G is the best value, like my mom. Is that how you feel?
While others feel that having an all-bundle plan with no premium, low copays, and having a drug plan, dental, vision, gym membership, over-the-counter items, transportation, and so forth is the best value for them. Now, these clients don't mind copays and they don't mind the MOOP or maximum out-of-pocket cost. The low or no premium along with the extra benefits is the most important to them. Is that what's important to you?
That brings us to point number 3, why you would choose a Medigap plan. The combined monthly payment for Medicare, Medigap, Part D, dental, and vision plans will total around $250 to $350 a month. If you want your freedom with Medicare or you want no copays like the F or G plan, then paying a higher premium doesn't bother you.
This reminds me of a client that we had on state welfare Medicaid, or here in California called Medi-Cal. She came into our office and said that she wanted to buy a Medigap Plan G. Now, of course, being on welfare, I was hesitant to enroll her, wondering how can she afford it. Well, she told me she was sick of being treated like a second-class citizen and wanted the freedom with original Medicare to get the best care possible. And she said that she will make it work. Well, so she disenrolled herself from Medicaid and bought a Medigap plan.
Yes, that's a great example, friends, that a Medigap is not only for those who have money.
And the opposite can be true. We have had hundreds of clients that have a lot of money and they never buy a Medigap plan. Recently, a couple that had over $2 million signed up for a Medicare Advantage plan. The value of a Medigap was just not worth the higher premium despite our 5-point checklist. They did not mind forfeiting their original Medicare as their primary or their copays. They wanted the lowest premium with the doctors on the network and the extra all bundle perks.
But everything we just said above could be meaningless for 2 reasons. Your network of doctors and the rules of changing. Some doctors do not take Medicare Advantage plans, or you see doctors in different networks. So why waste your time researching Medicare Advantage plans?
True. So now some of you have doctors that do not take original Medicare, like Kaiser. And if you absolutely do not want to change those doctors, then considering original Medicare and a Medigap might be a waste of your time. Now, of course, unless your monthly payment or co-pays or out-of-pocket is really high on the Medicare Advantage plan, then you might want to consider comparing a Medigap or other Medicare Advantage plans.
Now, let's discuss point number 4, the rules of changing. Let's look at the Medigap plan's one-time only open enrollment. See page 50 of this government guide called Choosing a Medigap Policy, and notice how it clearly states a one-time only, yes, not yearly, a one-time only 6-month period when federal law allows you to buy any Medigap policy you want that's sold in your state. It starts in the first month that you're covered under Medicare Part B and you are 65 or older. Of course, some states may have additional open enrollment rights under state law.
Yes, did you notice that the open enrollment lasts only 6 months? Now, what if you missed it? Then you must have a special event or a guaranteed issue right. And for some of you viewers with a birthday rule in your state, the birthday rule does not allow you to switch from an Advantage plan to a Medigap plan. It only applies to changing your Medigap to another Medigap that's typically equal or lesser in coverage. So if you're outside the 6 months rule, well, you have to answer health questions or have a special event. So some have asked us, well, what are the health questions? Well, please be careful. Every Medigap insurance company has its own set of health questions, and they can change each year. That's why we don't show a list of all the health questions. Plus, while you might be healthy now, your health could change later. That is why they make it a one-time only open enrollment.
What are some of the special events or guaranteed issue rights? On pages 22 and 23, it lists the most common events such as your plan is leaving Medicare or stops giving care in your area, or you move out of the plan's service area.
Or you have a trial right, meaning you join a Medicare Advantage plan when you're first eligible for Part A at 65. And within the first year of joining, yes, less than 12 months, folks, you decide you want to switch towards Medicare. Then you have a guaranteed right to buy any Medigap that is sold in your state through any insurance company.
So what's the October to December open enrollment for then? It applies to changing from original Medicare with a Medigap to a Medicare Advantage, or Medicare Advantage to Medicare Advantage.
Also, don't forget the January to March open enrollment. During this time, you can do one of two things. One is you can drop your Medicare Advantage plan and go back to original Medicare, and you must purchase a drug plan. Or you can switch your Medicare Advantage plan to another Medicare Advantage plan.
But again, not your Medigap.
That's right. So what if you're not healthy enough to qualify later for a Medigap or don't have a special guaranteed issue right? What if you're concerned that the insurance company has the right to control your care? Well, if you're more about the what if and you're that type of person, then you should choose a Medigap or supplemental plan like Aunt's mom.
To sum it up, as one of our commenters, David Hill, so nicely put it, insurance is about risk. What type of risk are you willing to take? Are you okay with having copays? Are you okay with taking the risk of possibly not being able to go back to a Medigap?
David Hill's wife has had a Medigap for 9 years, and David, in his own words, has enjoyed his zero premium PPO Advantage plan. Now, like my mom, David is okay with the risks we just mentioned. Now, to read his full experience, click on the card above or the link in the description below.
How about you? After learning the rules of changing, are you okay with these risks and prefer a Medicare Advantage plan? Or are you more of the what if person and would rather choose a Medicare Supplement Medigap plan? Let us know in the comments below. Again, your comments not only help us out, but also tells YouTube to recommend this video to other people that are confused about this very topic.
Now for our final point, perhaps the most important point, point number 5. The number one reason Medicare is so confusing. Why is it so hard for consumers to make the right decision? Is greed and the lack of transparency. Now, it did start off with good intentions. Private insurance plans were introduced into Medicare program in 1999 and were called Medicare Choice, not Medicare Advantage plans. Unfortunately, the greed within the insurance companies has caused untold denials of care in order to keep more money for themselves instead of approving needed care. So while the intentions of starting Part C or Advantage plans was good to save Medicare money, it has also wasted billions of dollars.
To be clear, we are not against them, and many claims have been paid, as we already discussed.
Now, to show the greed and the lack of transparency is when the name changed under the 2003 Modernization Act from Medicare Choice to Medicare Advantage. Yes, that's the key to this confusion. Think about the word advantage. All I know is every time we put a line down the middle where we write down pros or advantages on one side and the other side is automatically cons or disadvantages.
Right, so if Part C is an advantage, what is original Medicare or Medigap supposed to be?
Naturally a disadvantage.
Right. Yes, friends, do you see the subliminal sales pitch in marketing for the government?
Well, how are viewers like you supposed to make an informed, unbiased decision when all the bias in sales pitches is coming from the top, the government? Now, we cannot emphasize enough, we are not against Medicare Advantage plans. However, we feel the name should be changed from Medicare Advantage to Medicare Replacement or Medicare Alternative plans. If the government is not clear on this matter, do they require the insurance companies then to be so straightforward? And when was the last time you saw an insurance company advertise that their Medicare Advantage plan replaces Medicare? And when have you ever seen in writing a disclosure that the Medicare Advantage plan receives around $1,000 per member each month from the government? When have you seen the commercials from Medicare or the insurance companies saying that open enrollment does not apply to a Medigap and the consequences of possibly not being allowed to return to a Medigap if you choose a Medicare Advantage plan? Why doesn't the government or the insurance company clearly state that you forfeit or give up your original Medicare plan while under the Medicare Advantage plan in their advertisement? Sorry for my ranting. I know I made it sound like I'm against Medicare Advantage plans, again, which we are not. My mom and other people of our clients have them as well. We're just sick of the lack of transparency as it makes everyone confused every year. And it makes our job harder to always clean up this messy confusion.
So why are some insurance agents biased towards one side over the other? Well, some agents are not independent and only licensed to sell certain plans, such as a Medigap plan, because it is much easier to get licensed in multiple states, and typically there is no yearly recertification or test to take for Medigap plans.
And while selling Medicare Advantage plans, we have to recertify and retake a test every year for every single insurance company that we're licensed with. And some insurance agents do not want to go through all that work.
What about those brokers that are truly against Medicare Advantage plans for legitimate reasons?
Yes, and we agree with some of those reasons. However, that's like telling people never buy a truck because it wastes so much gas, or never buy a laptop because a desktop computer is better and faster. Now, I know healthcare is different. However, each person has their own perceived values, as we discussed earlier. And we do not believe in pushing what we perceive as a better value. We rather show the pros and cons with full transparency and let you decide.
And what about the facts that Medicare Advantage plans pay more commission?
Again, this is true. Medicare Supplement plans typically pays around $20 to $30 a month for about 6 years. After 6 years, we typically receive no commissions or around $3 to $5 a month.
Whereas Medicare Advantage plans are double the amounts per month for the first year and half of that per month as long as you are a client. Yes, lifetime commission versus 6 years.
What do you think about this commission that we just mentioned? Do you think if the insurance companies paid agents the same, whether it was a Medigap or a Medicare Advantage plan, there would be fewer commercials and push for the Medicare Advantage plans? Do you think the government should be completely transparent and eliminate the name Advantage? Well, what do you think they should change the name to?
We hope you can see through our videos that our goal is to break through all the sales pitches and biases and to give you complete transparency and clarity so that you can make the most informed decision. We represent over 50 plans and can assist you in 50 states. So, did we meet our goal through this video and clarifying your confusion? Do you know which side you prefer? Again, please help us out and others by sharing your comments below, clicking the like and subscribe button, and turning on your notifications bell.